All right, let's talk about one of the most high stakes topics you're going to see on the NCLEX, musculoskeletal nursing. It is absolutely packed with priorities, safety alerts, and, yeah, a few nasty traps. So let's get into it. Okay, I want you to picture this. You're on your shift, and your post op hip patient is suddenly in absolute agony. We're talking 10 out of 10 pain. And the morphine you just gave, it's not even touching it. What is the very first thing you do? This isn't just a bad day at work, my friend. This is a classic NCLEX question.
And that's exactly why this stuff is so important. The NCLEX isn't going to ask you to just, define a sprain. No way. It's going to throw you a curveball to see if you can spot a disaster before it happens. Getting this down isn't just about passing your exam. It's about keeping your patient safe.
So before we can tackle those big emergencies, we have to make sure our foundation is rock solid. Let's start by breaking down the injuries that everyone seems to get mixed up. Sprain versus strain happens all the time, but here's the only trick you'll ever need. A sprain is an injury to ligaments, from a nasty twist or a fall. A strain, though, that's your muscles or tendons. And the way to remember it is right in the word itself. Strain has a T in it. T is for tendon. Boom, you will never forget that again.
All right, now for fractures. Pretty simple, right? It's a break in the bone. But for the NCLEX, what really matters isn't the definition, it's the goal of treatment. And it's always a two-step dance. First, reduction, which is just a fancy word for getting the bones lined up again. And second, fixation, which means holding them right there so they can heal up properly.
Okay, so our foundation is set. Now, let's get to the really critical part, the major safety alerts, the high-priority stuff you absolutely have to know for the exam. And here is the number one giant flashing red flag in MSK nursing: compartment syndrome. This is a true limb-threatening emergency. Basically, the swelling inside a muscle gets so bad that it literally chokes off the blood supply. No blood flow means tissue starts to die, and that patient could lose their limb. It's a huge deal. Another huge area of focus is your post-op hip fracture patient. Once that new hip is in, it's really, really vulnerable. So our number one job as the nurse is to make sure that new joint does not pop out of place. So how do we do that? By following these rules. And I mean, these are non-negotiable. The patient cannot bend their hip more than 90 degrees. So no leaning forward to tie their shoes. They absolutely cannot cross their legs, and they can't turn that affected leg inward. These precautions are everything. All right, we've got over the core ideas and the biggest red flags. Now, for the fun part. Let's load up your brain with some simple memory hacks that are going to make all this information stick, especially when you're feeling that exam pressure. For pretty much any soft tissue injury, you just need to remember PRIC. It's a classic for a reason. You protect the area, you rest it, you put ice on it, you use compression like a bandage, and you elevate it. It's your go-to plan for immediate care. Okay, so back to that really scary emergency we talked about. How do you actually spot it? How do you know if there's a serious neurovascular problem? Simple. You're going to run through your new best friend, the 5 Ps. And here they are. This is your essential checklist. You're checking for pain, especially pain that seems way worse than the injury should be. You're checking for a pulse, or a lack of a pulse. Pallor, which means the skin looks pale or feels cool. Paresthesia, that's that weird pins and needles feeling or numbness. And the last and most serious sign, paralysis, where they just can't move it. Okay, you've got the knowledge, you've got the memory tools, it's time to put it all together. Let's see how you handle a classic NCLEX-style question. So here we go. You have a patient with a brand new leg cast. They tell you their foot feels kind of asleep, and when you check it, it feels cold. Your internal alarm bells should be screaming right now. What is your absolute first move? Okay, your options are A, give them some pain meds. B, chart your findings. C, prop the leg up on some pillows. Or D, perform a full neurovascular assessment. Go ahead and pause here for a second. Think about it. What's the number one rule of nursing? What comes first? If you picked D, you are 100% correct. Why? Because that asleep feeling is paresthesia, and that cold skin is pallor. Those are 2 of the 5 Ps. This is a massive warning sign. And on the NCLEX and in real life, you always, always, always assess before you intervene. Great job on that. Seriously. Okay, let's lock in the most important takeaways with a quick rapid-fire review. Ready? Let's go. Sprain is for your ligaments.
Strain is for your muscles and tendons. Just remember that T in strain for tendon. Got it?
Your safety check for any MSK problem is always your neurovascular assessment. Run through those 5 Ps: pain, pulse, pallor, paresthesia, and paralysis, every single time.
And for your post-op hip patients, the mantra is simple. No bending past 90, no crossing the legs, and no twisting that leg inward. Easy.
And that really brings us to the most important point. When it comes to musculoskeletal nursing, a thorough assessment isn't just another task on your to-do list, it's the priority. It is the one thing you can do that truly has the power to save limbs and to save lives.